Fluoroquinolone antibiotics, clinical use and emerging resistance. Fluoroquinolones are broad-spectrum antibiotics effective against diverse bacterial infections, but their widespread use has driven significant antimicrobial resistance patterns worldwide. Understanding fluoroquinolone antibiotics. Fluoroquinolones represent an important class of synthetic antibiotics that have played a crucial role in treating bacterial infections since their introduction in the 1980s. These medications work by inhibiting bacterial DNA gyrase and topoisomerase 4, enzymes essential for bacterial DNA replication and transcription. This mechanism of action allows fluoroquinolones to target a wide spectrum of gram-positive and gram-negative bacteria, making them valuable therapeutic tools across multiple medical specialties. The development of fluoroquinolones marked a significant advancement in antimicrobial therapy, offering oral bioavailability combined with broad-spectrum activity, a combination that was previously unavailable in many antibiotic classes. Clinical applications and therapeutic uses. Fluoroquinolones, with ciprofloxacin being one of the most commonly prescribed members of this class, have demonstrated efficacy across numerous infectious disease conditions. These agents are particularly valuable in treating complicated urinary tract infections, where their excellent urinary penetration and broad-spectrum coverage provide therapeutic advantages. Respiratory tract infections, including community-acquired pneumonia and exacerbations of chronic respiratory diseases, frequently respond to fluoroquinolone therapy. Additionally, these antibiotics have established roles in managing intra-abdominal infections, bone and joint infections, and certain gastrointestinal pathogens that cause infectious diarrhea. Key points: urinary tract infections and complicated UTIs with systemic involvement. Lower respiratory tract infections and community-acquired pneumonia. Bone and joint infections, including osteomyelitis and arthritis. Intra-abdominal infections when combined with other antimicrobial agents. Routes of administration and pharmacokinetics. One of the distinctive advantages of fluoroquinolones is their versatility in administration routes, allowing clinicians to tailor therapy to individual patient circumstances and clinical settings. Oral formulations provide excellent bioavailability, enabling effective treatment in outpatient settings and reducing the need for hospitalization for many infections. When oral therapy is not feasible due to gastrointestinal dysfunction or severity of illness, intravenous formulations deliver rapid systemic levels of the drug. Beyond systemic administration, fluoroquinolones are available in topical preparations, including ophthalmic drops for treating eye infections and otic formulations for ear infections. This flexibility in drug delivery represents a significant clinical advantage, as it permits seamless transitions between treatment settings and dosing methods based on patient response and tolerance. The resistance problem, origins and mechanisms. The extensive use of fluoroquinolones, while therapeutically beneficial, has created selective pressure that has substantially accelerated the emergence and dissemination of resistant bacterial strains. Resistance to fluoroquinolones develops through multiple molecular mechanisms, with chromosomal mutations representing the primary pathway. Bacteria can alter their DNA gyrase and topoisomerase 4 target sites through point mutations, reducing antibiotic binding affinity and thereby lowering drug efficacy. Additionally, bacteria can upregulate efflux pump systems that actively remove fluoroquinolones from the cell, maintaining intracellular drug concentrations below levels needed for bacterial killing. Plasmid-mediated resistance mechanisms have also emerged in recent years, spreading resistance genes between different bacterial species and complicating infection control efforts. This multifaceted approach to resistance development demonstrates the remarkable adaptive capacity of bacterial organisms. Global resistance patterns and epidemiology. Fluoroquinolone resistance has achieved concerning prevalence rates across diverse geographic regions and clinical settings. Common pathogens previously susceptible to these agents, including various Enterobacteriaceae and Pseudomonas aeruginosa, now frequently demonstrate resistance in surveillance studies. Regional variations in resistance rates reflect differences in antibiotic prescribing practices, infection control measures, and healthcare infrastructure. Developing nations with limited antimicrobial stewardship programs often experience higher resistance rates, while even countries with sophisticated healthcare systems have witnessed substantial increases in fluoroquinolone-resistant organisms. Healthcare-associated infections, particularly those caused by multi-drug-resistant gram-negative bacteria, frequently involve fluoroquinolone-resistant strains, complicating treatment options and increasing morbidity and mortality. The World Health Organization recognizes fluoroquinolone resistance in several pathogens as a critical public health threat requiring urgent attention. Clinical consequences of resistance development. The emergence and spread of fluoroquinolone-resistant bacteria have substantial implications for clinical practice and patient outcomes. When organisms causing serious infections prove resistant to fluoroquinolones, physicians must resort to alternative antimicrobial agents, which may carry higher toxicity profiles, require more frequent dosing, be less bioavailable orally, or carry increased costs. Treatment failures in infections that would have previously responded reliably to fluoroquinolone therapy necessitate repeated courses of different antibiotics, prolonging illness duration and increasing healthcare expenses. In severe infections such as sepsis or meningitis caused by resistant organisms, the loss of fluoroquinolone as a therapeutic option may require expensive intravenous agents or combinations with inferior penetration to infection sites. Moreover, resistance patterns complicate empiric antibiotic selection in clinical scenarios where culture results are not yet available, potentially delaying appropriate therapy. The cumulative burden of resistant infections extends beyond individual patients, straining healthcare resources and contributing to rising antibiotic expenditures globally. Relationship between prescribing practices and resistance. Extensive research has established clear correlations between fluoroquinolone utilization patterns and the subsequent development of resistance in bacterial populations. Excessive prescribing for self-limited infections that would resolve without antibiotics, inappropriate use for conditions unlikely to be bacterial in origin, and treatment duration exceeding evidence-based recommendations all contribute significantly to resistance selection. Fluoroquinolones prescribed for minor respiratory tract infections, where viral pathogens predominate, create resistance without providing therapeutic benefit. Similarly, using these agents for uncomplicated, asymptomatic bacteriuria or other conditions not requiring treatment represents unwarranted exposure. Geographic areas with high fluoroquinolone consumption consistently demonstrate elevated resistance rates, supporting the causative relationship between prescription volume and resistance emergence. Healthcare institutions implementing antimicrobial stewardship programs that restrict fluoroquinolone use to appropriate indications have documented measurable reductions in resistance rates among targeted pathogens. Antimicrobial stewardship and appropriate use. Reversing the trajectory of fluoroquinolone resistance requires fundamental shifts in prescribing culture, supported by evidence-based stewardship initiatives. Clinicians must carefully evaluate whether fluoroquinolone therapy is truly necessary for each patient, considering alternative agents with narrower spectra when susceptibility allows. Treatment duration should adhere to published guidelines rather than extending therapy based on arbitrary time intervals or patient preference. Local resistance surveillance data should inform empiric antibiotic selection, allowing clinicians to choose agents less likely to select for resistance in their particular institutional environment. Oral to intravenous conversions should occur as soon as clinical improvement permits, reducing unnecessary systemic exposure. Educational programs targeting healthcare providers must emphasize the consequences of resistance and the role each prescriber plays in collectively preserving fluoroquinolone efficacy. Systems-level interventions, including formulary restrictions, prior authorization requirements, and mandatory infectious disease consultation for selected uses, have proven effective in institutions willing to implement comprehensive stewardship strategies. Future perspectives and drug development. As fluoroquinolone resistance continues to expand, researchers are pursuing multiple strategies to maintain options for treating serious bacterial infections. Newer generation fluoroquinolones with enhanced activity against resistant organisms have been developed, though these agents remain subject to the same resistance mechanisms that limit their predecessors. Combination strategies pairing fluoroquinolones with adjuvant compounds that inhibit resistance mechanisms show promise in laboratory studies but face challenges in clinical translation and regulatory approval. Simultaneously, development of entirely novel antibiotic classes proceeds, though the financial and regulatory barriers to antibiotic development remain formidable obstacles. Prevention of infections through vaccination represents another critical approach, reducing the absolute number of infections requiring antimicrobial therapy and thereby decreasing selective pressure for resistance. International cooperation in surveillance, resistance tracking, and stewardship implementation will be essential to preserving the clinical utility of remaining therapeutic options for serious bacterial infections. Patient safety considerations and adverse effects. Beyond resistance concerns, fluoroquinolone use carries inherent risks of adverse effects that must be weighed against therapeutic benefits when considering these agents. Black box warnings from regulatory agencies highlight serious adverse reactions including tendinopathy, peripheral neuropathy, and central nervous system effects that have been documented with fluoroquinolone exposure. These safety considerations further support judicious use restricted to situations where therapeutic benefits justify the risks. Older patients, those with renal impairment, and individuals receiving corticosteroids or other medications that increase adverse effect risk warrant particularly careful consideration before fluoroquinolone therapy. Documenting clinical justification for fluoroquinolone prescribing helps ensure that risk-benefit analyses have been appropriately considered and provides evidence supporting the therapeutic necessity of treatment. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.